Focus ultrasound is a revolutionary technology and that is changing the way we treat neurological and psychiatric disorders. It offers a less invasive and precise and safe option for patients who previously had very few choices. I do believe that focus ultrasound has the potential to transform the standard of care for many diseases, giving patients new hope and better quality of life.
Welcome to Curing with Sound, a podcast presented by the Focus Ultrasound Foundation. I'm your host, Allison Preston Smith. Dr. Shiro Horisawa is the director of Stereotactic and Functional Neurosurgery at Tokyo Women's Medical University. His pioneering research explores innovative clinical applications of deep brain stimulation and focus ultrasound for movement disorders and psychiatric conditions. He has performed more than 1,500 stereotactic brain surgeries and has published more than 50 international papers. Welcome to the podcast, Shiro.
Thank you so much for having me today.
Thank you so much for being here. Much of your research focuses on movement disorders, mainly cervical dystonia. Can you share what cervical dystonia is?
Cervical dystonia is a neurological disorder that causes involuntary muscle contraction in the neck, and it can lead to abnormal head postures such as twisting and tilting and pulling on to one side. And patients often suffer not only from pain and stiffness, but also from social and emotional stress because of the visible symptoms.
What are the traditional treatments for cervical dystonia?
Yeah, the traditional treatments include botulinum toxin injections and a lot of medications like muscle relaxants, and in more severe cases, a deep brain stimulation surgery. And the botulinum toxin injections can be very effective, but requires repeated every few months. And some patients do not respond well. And in Japan, it's very expensive treatments. And all the medications often have very, very limited effects and also cause side effects like drowsiness. That is a very serious complication for the patients.
And what drew you to this area of study?
When I started my career, I performed many cases of radiofrequency ablation for cervical dystonia. So I found that RF, radiofrequency ablation, could achieve results comparable to deep brain stimulation. And sometimes patients were even cured with radiofrequency region alone. And many patients have a strong resistance to the idea of having a device permanently implanted in their bodies. But the patients' interest and the demand for radiofrequency region therapy are very, very strong. That's why I felt a strong motivation to research and share the potential of RF treatments with the world. And as part of that effort, I published several papers on radiofrequency for cervical dystonia. And very, very naturally, I began to think about focus ultrasound could be another way to treat cervical dystonia, similar to radiofrequency region, but without any incision or implanted devices. That is a very good hope for the patients.
You recently published results from a clinical trial looking into the safety and efficacy of focus ultrasound for cervical dystonia. Can you tell us about your findings?
Thanks to the Focus Ultrasound Foundation, their support, we successfully published the results of our clinical trial on investigating the safety and efficacy of a focus ultrasound for cervical dystonia. In that study, we enrolled 10 patients with cervical dystonia and who are refractory to botulinum toxin injections. And 6 months after treatment, we observed an average improvement of 43%. And some patients showed remarkable outcome with improvement of over 90%. Others showed 20 to 30% improvement. And importantly, there were no serious complications, no serious treatment-related complications. And overall, the effectiveness of the treatment appeared comparable to what we typically achieve with a radiofrequency ablation.
Did you hear from any of the patients about the impacts this had on their lives, or any other specific messages from them?
Yeah, from 10 patients, I found several very interesting stories in 2 patients. And one patient is the first case of this clinical trial. she had hypertension with cervical dystonia, and she took 2 types of anti-hyper medications. And her blood pressure, systolic blood pressure, was 150 or 45 or so. And after the focused ultrasound treatment, her blood pressure decreased to 120 to 130, and she discontinued 2 types of anti-hypertensive medications. So I'm not sure this treatment actually improved the hypertension, but she was also very, very happy to be free from medications for hypertension. And now is 3 years after the treatment, she's still free from anti-hyper medication. That was a very interesting story. Another case, this is also a woman's patient. She had a cervical dystonia with very serious anxiety. And in this clinical trial, we measured before and after the anxiety measurement. And after the treatment, her anxiety score, I think 90% to 95% improvement. And she was very, very happy to be free from unnecessary worry or unnecessary anxiety. So this is a very interesting comorbid findings in this clinical trial. But anyway, the half of the patients are very happy, but half of the patients still need to the additional treatment. That is a very big challenge and our next problems to be solved.
And you're going to be starting a new clinical trial focusing on hand dystonia soon. How will the findings from your study on cervical dystonia inform this new trial?
Yes, that clinical trial of focused ultrasound is cervical dystonia is a separate study from the upcoming trial on hand dystonia. And the hand dystonia is based on a pilot study we conducted in 2018 with the support of the Focused Ultrasound Foundation, where we treated 10 patients for focal hand dystonia. And the hand dystonia, like essential tremor, severely affects hand function because involuntary muscle contraction in the hand when performing a specific task. So patients often struggle with basic manual tasks such as writing or playing musical instruments. And unlike cervical dystonia, which is more commonly treated with botulinum toxin or oral medications, but hand dystonia is more difficult to treat with conventional treatments. And surprisingly, this condition is not typically considered a surgical candidate worldwide. And hand dystonia often develops after repetitive movements over a long period of time, which is why it is common in musicians and professional athletes. So actually, we have so many professional musicians all the way from United States or UK or Germany or so many countries because no neurosurgeon do this kind of the surgery. And this is a very, I think the hand dystonia clinical trial is really, really promising for hand dystonia patients all over the world. I think that if the focused ultrasound and treatment accepted for a focused ultrasound clinical trial showed a good result, good outcome, and accepted in the worldwide, I think the majority of the neurosurgeons understand how this treatment are valuable for focal hand dystonia, and I think it's more easy to persuade the neurologist. This is a good treatment for hand dystonia patients.
How has the technology evolved since you began working in the field?
Yeah, when I first started working with focused ultrasound, the main clinical targets were essential tremor and Parkinson's disease. And since then, the technology has evolved significantly. And today, with the addition of a clinical trial for dystonia, we are approaching a future where focused ultrasound could treat almost all types of the movement disorders. At the same time, clinical trials are now being conducted for psychiatric conditions and epilepsy. And I believe the range of applications will continue to expand. And the technological innovation is also happening at an incredible speed. So focused ultrasound is now being explored as a tool for drug delivery in difficult to treat diseases. It's like Alzheimer's disease and malignant brain tumors. So it's truly an exciting time for this field.
How do you hope to see the field grow in 3 to 5 years?
Yes, in the next 3 to 5 years, I hope to expand the use of focused ultrasound for treating movement disorders, especially dystonia, through our new clinical trial, upcoming new clinical trial for focal hand dystonia. I want to help establish focused ultrasound as a treatment for dystonia worldwide. So beyond movement disorders, I also hope to see focused ultrasound applied more widely to epilepsy and psychiatric conditions.
Are there any other diseases that you're researching? You just mentioned potentially psychological conditions. Is that an area you're hoping to break into?
Yeah, besides dystonia, I said earlier, I'm very interested in researching psychiatric conditions such as obsessive compulsive disorder, depression, and anxiety disorders, as well as epilepsy. And my interest comes from clinical experience. And in treating the pituitary tract, or more precisely the Forest Field H region, this is a target used in the clinical trial for cervical dystonia, my clinical trial. And I have seen dramatic improvements not only in dystonic symptoms, but also in coexisting OCD, depression, and epilepsy. The pituitary tract area, Forest Field H area, contains many important fiber pathways beyond just the motor circuits. So based on these, my experiences, I do believe that Forest Field H could become a new and promising target for focused ultrasound treatment or psychiatric and epileptic disorders in the future.
How has the foundation played a role in your work?
Yes, the Focus Ultrasound Foundation has played a very, very important, vital role in my work, not only in my work, all over the world. And they supported not only our pilot study for focal hand dystonia 2018, but also our clinical trial for cervical dystonia. Their support was incredible. And without their support, and research like this would have been impossible. And the research using focused ultrasound for dystonia is still very limited worldwide. And the foundation's support has become a real source of hope for dystonia patients everywhere. Actually, I receive so many inquiries almost every week from patients who found our study, our clinical trial on the Focused Ultrasound Foundation's website, and they are seeking treatments every time. So their support has truly made a global impact, and many patients are watching these clinical trials with great hope.
How can our audience keep up with you and your work?
Yes, you will find information about my upcoming clinical trial on the Focus Ultrasound Foundation website, so please check. And if you search my name on Google Scholar, you can also find so many papers published. And additionally, I have an account on X, formerly known as Twitter, so where I occasionally share updates about my research works. So following these sources would be a great way to stay connected with my latest research.
Well, thank you so much, Dr. Horisawa, for coming on the show and talking to us about all the important research that you're doing. We're so lucky to have you.
Yes, thank you very much for having me today. So it's been a true honor to share my journey, my research, my dreams with all of you. So Focus Ultrasound is opening new doors for patients around the world, and I'm very, very excited to be part of this incredible movement. I hope that through continued innovation and collaboration, we can bring new hope and better lives to patients who need it most. So thank you again for your interest and support. Thank you.
This episode of Curing with Sound has been presented by the Focus Ultrasound Foundation. If you'd like to learn more about Focus Ultrasound or the Foundation, visit our website at fussfoundation.org. You can also sign up for our newsletter and follow us on social media. Be sure to subscribe to the Curing with Sound podcast so you don't miss the latest information about Focus Ultrasound. You can also rate and review the show.